Managing stress and distress in people living with dementia. Should restraint be an option? When caring for people with dementia, there are certain times we can't prevent them from becoming upset and occasionally acting in agitated or aggressive ways. Although rarely required, caregivers sometimes need to apply pressure and force to the person's body to prevent them harming themselves or those around them. At these infrequent but highly stressful times, carers need to feel prepared, confident and competent to deal effectively with these emotional situations. The behaviours displayed by the person living with dementia may be due to them feeling over-controlled, excessively bored, or due to pain or confusion. It can also happen with people living with dementia when they start to lose insight that they require assistance with their personal and intimate care needs. The carer's responsibility for providing such care, assisting with the use of the toilet and/or hygiene tasks, can sometimes lead to conflict because carers are required to interact up close and personally with the person with dementia when performing intimate actions. Unsurprisingly, if the person living with dementia does not see the reason for getting such help, they'll get upset, stressed and distressed. The person may even hit out, or at the very least, use force to prevent the important care tasks being undertaken. Unfortunately, we can't just ignore such occasions and simply hope for the best. We need to become skillful in working with such scenarios and be able to help others manage them effectively. So we need to be prepared to develop the skills and confidence to deal with the emotional situations, ensuring the person experiences the least distress possible and that they are kept safe. We must also ensure that those around them are kept safe too. Developing such skills is particularly important for managers, advisors, NHS and social care staff. This is because they are often the people asked to provide assistance with these more difficult situations and behaviours. Now let's look at the issue of restraint, which is to do with the application of any form of force. Restraint is a complex area, but it can be seen as any intentional restriction of a person's voluntary movement or behaviour. Here behaviour means planned or purposeful actions by the person, not unconscious or accidental actions. An alternative plain English definition is stopping a person doing something they appear they want to do. In the current context of assisting a person to change their clothing due to them being incontinent, this means a carer would be said to be restraining the person who has been incontinent if the carer used any actions that prevented the person from moving freely while their clothes were being removed or during the washing and cleaning process. Restraint is commonly used in dementia care because the person living with dementia may lose insight that they require assistance with their personal needs, and so misinterpret the carer's action as an attack or some other form of assault. Hence, during the delivery of care the person is receiving, they may physically object, avoid, or hit out at the carer. These are some of the typical actions that may need restraining. There are a number of forms of restraint. Physical, as in the above case. There's also environmental, such as using locked doors, or chemical, such as using sedatives or other drugs. Mechanical forms, using specifically designed equipment, including straps. It's worth familiarising oneself with all these different forms of restraint. The use of restraint usually forms part of PMVA training programs, which we'll now turn to. PMVA stands for Prevention and Management of Violence and Aggression. These are specific techniques, both verbal and non-verbal, sometimes using physical hand and body holds designed to keep both the person living with dementia and their carers safe. The caregivers usually attend courses to develop skills and attitudes to effectively employ de-escalation skills, breakaway, and disengagement tactics. The terms we've described above are quite complex, so we would advise you to look at the policies in your organisation that govern the use of hands-on care when working with people who lack capacity. Management strategies. If a person with dementia is receiving restraint on a regular basis, it's appropriate to produce a care plan relating to how that restraint should be administered. The care plan will provide a blueprint outlining the sort of restrictions that you will need to use, gentle pressure on hands or specific forms of holding techniques that you'll need to apply. To produce the care plan, you'll need to collect information from lots of different sources. So it's often helpful to produce a formulation to aid you to develop the care plan. A formulation is a bit like a detective's crime board, identifying all the relevant information about the situation and how the information relates to each other. We are sometimes asked whether the use of formulation is important. Our view is that if you find yourself being required to employ restraint on a regular basis, then the use of a formulation is the ethical and appropriate tool to use. Indeed, it could be deemed by some that not using one is unethical. This is because the formulation is a major aid in ensuring you get an idea of the causal and maintaining factors associated with a person's stress and distress. The care plan will also be informed by the caregiver's experiences of what they have done in the past that was helpful, and also indicate what's being unhelpful. The information needs to be written very clearly. It should be smart, providing specific information that is measurable, achievable, and can be realistically carried out in the time available. The contents of the plan need to be written so well that someone who has never seen the person before is able to carry out the activities in exactly the same way as used by those highly experienced in managing the person's needs. Some of these effective approaches and skills may have been learnt through trial and error, and so we don't want to go over all the inappropriate strategies again, approaches that someone else has already learned to be unhelpful. When plans are written well, they also allow us to share the management details with others, those who may be providing care in the future, such as following a transfer or a discharge from a ward. A good care plan will thus inform us when things like restraint should and should not be used, and ideally how many carers are needed to help with a certain activity, what to say and what not to say, likewise what to do and what not to do. Also identify when it's best to back off. Like all new skills, carers will need practice in developing formulations and care plans and the execution of these plans. To help carers develop confidence and competence in these activities, effective training and coaching will be vital.